I'm joined today by Dr. Ashwini Zenooz, the Chief Medical Officer and GM for Healthcare and Life Sciences at Salesforce.com. Prior to that, Ash was the Chief Medical Officer at the Department of Veterans Affairs, overseeing the National EHR Modernization Program. Ash is a board-certified radiologist. In this episode of Tuning Healthcare, we discuss what an incredible time it is to be in healthcare as we're at the forefront of digital transformation. That this is the time for interoperability and how we will soon see an ecosystem of APIs. The importance of focusing on the patient and the opportunity to improve the customer experience in healthcare. And finally, the need for a personal kitchen cabinet. Join Ash and me as we tune healthcare. Ash, thank you so much for joining me today. It's a real privilege for us to chat to you. I feel like there's so many topics that we could cover over the course of this podcast, but I'd love to begin with just a little bit about background. How did you get into medicine? Why radiology? And sort of like, how did you get your start?
Well, Nigel, thanks so much for having me, first of all. I have probably wanted to be a physician for as long as I can remember. My grandfather was the concierge physician in our town who rode around on his bicycle seeing patients. And so, we have a long history. His father was a physician, the town physician. I have come from a family of physicians. So I think I probably didn't know anything else. And I was so fascinated. My father's a veterinarian. So just really interested all my life in medicine. And when I got into it, there were really a couple of things. I loved the diagnosis of things, and I like to put things together, and it's like a puzzle piece, and I like procedures. And so there are only a couple of things where that would all come together. And for me, that was radiology. Radiology is a place where, you really take all of the history, look at the different pieces of the puzzle in an image, tie it all together in a nice package, if you're good at it, that is. And then if you're an interventionalist or you do interventional or procedures, you actually get to see patients and you get to have that continuity of relationship. And so for me, that was like the perfect balance. And so I've enjoyed being a radiologist and practicing medicine.
That's great.
Fun. Yeah.
And what was the impetus to go to the Hill? Right, to sort of move out of you still practice, but to move out of sort of everyday practice and to take to try and impact healthcare, on such a much grander level, right? The scale of impact that you could have in the Hill, obviously at the VA and at Salesforce is much greater. So what was the impetus for making that change?
Yeah, I think I would say I just sort of fell upon it initially. When I moved out to Palo Alto, I had the opportunity to serve as a subject matter expert on one of the House committee briefings and started visiting the Hill. And for many years after that, I would attend as a subject matter expert and spent a lot more time on the Hill. And I thought that was fabulous, but I really loved still practicing. So I never saw that as something I would go do. And then my mother got sick and I became a caregiver. I saw her go through the process of being a patient in this country. And I had worked at some of the best institutions in this country. And I really was flabbergasted at how broken our system is. I don't think I'd ever seen it or thought about it from the other side, from what a patient has to experience, not only from the healthcare delivery side, but working with the insurance companies, getting the thousands of pages of notice of explanation, benefits explanations that to me, it was like gobbledygook, right? I was like, I don't understand what this is saying. And if I don't understand what it's saying, how is somebody who's like a layperson supposed to understand this? And then really end of life, like working with the pharma companies for her end of life potential treatments. I think it just opened my eyes to the parts of healthcare I just didn't pay attention to, even though I had so much, I was steeped in it. So at some point, I think I just decided I'm going to have a bigger voice and I'm going to speak based on my experiences, both as a clinician and as a caregiver on behalf of, my mom who did not have a voice, and carry that forward. And I think that was like my transition to the Hill.
Right. That's incredible. And for any of us, right, who have experienced a family member in hospital, you sort of really understand how important it is to play that coordination of care role. And it's and as you correctly say, there's so many parts of the healthcare system for those of us that are involved in it, every day, that it's still incredibly difficult for us to navigate. You then think about someone who doesn't know the healthcare system or doesn't have the medical background and knowledge that you have. It's frightening, and so it's it's obviously part of what Lumeris has spent a lot of time thinking about, and I'm sure you have as well, right? The whole basis of coordination of care and how can we do that more effectively.
Yeah, absolutely. And I think, I would go in and hesitate to say things at times because I had a relationship as a physician with a lot of the other caring providers in the system. And others in my family who are not clinicians were worried about asking something because they weren't sure it was relevant, right? So I think it's from both sides. Everybody benefits when you ask the questions. Everybody benefits when you have access to information and you can spend the time asking questions, spend the time getting the information, and there's an appropriate coordination of care, to your point, right? Those are all really important pieces that somehow, at least at that time, we had just missed, I think, as relevant to healthcare. And we were working in 15-minute blocks, seeing patients, and it's just not the right way to do things.
So let's, fast forward to tech and, Salesforce.com, which is obviously a titan in the industry, and a brand that's known across the world, but not necessarily a brand that's known for healthcare. So tell us a little bit about your role as the Chief Medical Officer of Salesforce, the GM of the Healthcare and Life Sciences division. What does that mean? What's success in your role look like?
Yeah, I mean, I was really attracted to Salesforce when I got here 2.5 years ago, because I think I just saw the relevance of this relationship platform that other industries were utilizing. And I saw how it would be really beneficial to really the healthcare industry, helping connect all the dots. So I was attracted to come here. And what I learned when I started looking at Salesforce is that they're not new to healthcare. Salesforce has been around for 20 plus years, 21 years. And the company has been working with healthcare and life sciences customers just as long. They started off as a sales platform, so that's how they sold into various life sciences customers initially, and then they grew into the service, and then the marketing, and broadened the integration. And then when they bought Tableau, it was when we, bought Tableau. It was really bringing all of that data and insights into a single place. But as you and I both know, healthcare is high in regulation and in complexity. So at some point, about 4 or 5 years ago, we decided that it was important to go deeper, to build more specific capabilities for these customers that we had and the ones that were coming on to Salesforce. So that's when we started an industry-focused vertical, and made a lot of sense to recruit folks like me. And so that's the makeup of my team. Folks that have been in clinical, have operational expertise, that have worked in life sciences, R&D, understand, what happens from molecule to market, and how to bring all of these technology capabilities and translate them, not only to understand what the customer is asking for, to be the translator for the customer, but to make sure those translations mean that you're actually building products that make sense for those customers. So that's what my team and I do. And last year or a little bit before that, I don't exactly remember, but I also took on the additional hat of Chief Medical Officer, which I will tell you has been incredibly challenging given that the pandemic soon followed. And I hope I've been useful to the company as a result. But really what that means is everything that I was doing for healthcare that my team and I were working on now became relevant to everybody else. Initially, it started in the public sector where we started working with governments, trying to build solutions during the pandemic to help, scale responses. And sometime during the course of last year, every company became a healthcare company. So we started interfacing across all the other types of companies that were thinking about having their employees back at work or employees that were at work. How do we keep them safe? How do we manage this contact tracing? How do we understand that somebody's getting tested and is negative? How do we have that command center? Do we need an emergency response management center where we account for PPE and the number of masks and gloves that we have? This applied to grocers, meat manufacturers, airline industry. I mean, you call it, we were talking to them. And so, that's been really incredible over this last year, trying to, understanding what other industries are thinking about. And then also thinking back to our own employees. How do we keep them safe? Initially, it was how do you keep them, safe physically, thinking about returning to work. But the pandemic has taken a toll on the mental health of people. So ensuring that we are providing the right type of benefits and thinking through these things for our employees. My team and I have been really important part of all of these conversations. So that's the makeup of my role. It's a little bit of this and a little bit of that.
And so it's fair to say that Salesforce views its role as how do we build products and services to enable sort of the existing healthcare players, right, to be more successful in delivering, high quality, efficient healthcare, as opposed to some of the, other Silicon Valley companies who seem to have more of a desire to, disintermediate the system in some way. Is that a fair assessment of how Salesforce views their role in healthcare?
Yeah, absolutely. I think we see ourselves, to your point, as an accelerator or a tool to help, empower our customers to do their jobs more efficiently and to deliver more personalized care for their customers, whether they're patients or members or whatever form the individuals, take. So yeah, I mean, we are not in the business of direct healthcare delivery. We are not in the business of providing insurance, et cetera, but we are building tools. What I say to most people is the way you know that we're working really well is that you never know that we are in there, right? So we should be the engine in the background that is bringing all these disparate sources of data to a single place so that the contact center agent or the care manager or somebody who's working in a research lab has all of that information at their fingertips and can have real-time collaboration. But I don't think it matters if they know that it comes from Salesforce. It means we're doing our job if it's working well.
Right. And, we've discussed this before on this podcast and many people have discussed it elsewhere. There's so much runway for healthcare organizations to learn how to treat a patient as a customer. We are so far behind. I mean, just like basic stuff, like, like what food you like, what, like just the type of stuff that if you show up to any type of industry that does customer service exceptionally well, we're so far behind and there's so much runway. I've said this before, I've written about it and we've spoken about it before, that the health system that really and truly figures out customer service is going to like run away with market share in their industry. And they, there's a belief that they have it, like that everyone will tell you we've got patient-centric care, patient-centered medical home, right? Give whichever model you want to put to it, but everyone will tell you they have patient-centric care. And we know that when we started talking about your mom, right? Anyone who's had an experience knows we have physician-centric care, right? I went to the doctor the other week and sat in the waiting room for an hour. Like I wouldn't dream of leaving a client of mine sitting in a waiting room for an hour, particularly with no sort of like explanation or can I reschedule? Can I, anyway, so I think there's enormous runway for companies like Salesforce to really make a meaningful impact to healthcare.
Yeah, absolutely. I mean, when you look at all these other industries, at how far they've advanced, every industry has learned that focusing on your customer, being customer obsessed, which usually ends up being the end user in each of those industries, really takes you a long way. We even have data that shows, individuals, people will leave their providers if they don't have ease of use or ease of access, right? If you don't give them easy tools to reach them, especially the younger generation will leave their providers. I don't think, I'm not even sure if people want primary care providers right now. I think it's incredibly important, but I don't think people see value because we're still working the old school way. So when you look at other industries, it's like I go to Marriott's, I stay at Marriott's all the time when I used to travel. They knew exactly what I wanted. I didn't have to tell them every single time that I don't like staying by the elevators, or I don't like staying, I like my pillows like this, whatever it is, right? They knew all
like the upgrade to the presidential suite.
Yeah.
They knew that. That was in your profile.
I always put that in there. Nobody ever listened to me, but that one got ignored. But, the retailers know who you are. Amazon knows who you are. They recommend things to me on Amazon, and I'm like, oh gosh, how did they know I'd run out of this, right? Like, they know exactly what my needs are, my household needs. Airlines know, they notify you, to your point, that you're running late or flights are 15 minutes behind. Yet, I wish I could say that healthcare had gotten there. My husband went in to see his physician yesterday, waited an hour and 15 or an hour and 20 minutes in the waiting room, had to cancel his other calls, and it was a 15-minute appointment, but it was an hour and 30 minutes of waiting. That would never happen in any other industry. Of course, you could say it's a pandemic, things are delayed, right? But unfortunately, that's just how it works in our industry. I agree with you. There's incredible learnings that we can have that's cross industry that we can bring to this, to the healthcare and life sciences arm. And if we just collected that data on people and understood their needs and notified people that said, oh, we're running a little bit late, just giving people a heads up, treating your patients and treating your members. Of course, we treat them like it matters from a healthcare perspective, but from a consumer perspective, it's really important to also value time for people. And when you do that, I think you're going to get a lot of loyalty out of people beyond just caring for somebody, right? So,
100%.
Yeah.
So talk a little bit to us about your thoughts on vaccine distribution. I saw, I think it was a quick clip recently where you sort of joked about we can't do this on an Excel spreadsheet, and it sort of seems like there's a little bit of an Excel spreadsheet might be an upgrade, right? Based on some of the things that at least the consumer sees, right? We know there's more that's going on behind the scenes. So tell us a little bit about vaccine distribution and what do you expect to see here, and what encouragement do you have based on the role that you've played?
Well, I mean, like I said before, I think technology has a huge role to play. But more importantly, before I get to that, I think we are dealing with the largest mass vaccination campaign probably in the history of, world's history, if not U.S. history. We are coordinating multi-dose regimens across multiple different types of vaccines for billions of people around the world. You must get the world to herd immunity, which means at least 70-80%, right, immunity. We cannot have silos of immunity. I mean, we've learned that already. We're seeing it with all the different strains that are popping up all over the place. So until we get the majority of the world's population vaccinated, shots in arms, we're not out of the woods. Having said that, I am incredibly impressed by the scientific community working with the government on how quickly we brought multiple vaccines to market. I'm really encouraged by the new vaccines that are coming up for EUA right in the next couple of weeks. Hopefully we'll have one, if not two more in the US. But I think, we've been hampered. We've been hampered because, like I said earlier, we're still working off of, probably phone calls and sticky notes, which, from what I remember from my government days, sometimes that's what happens during a pandemic or a disaster response. And you would think that you would have lessons learned, again, from every single time we go through a disaster response or a pandemic or an epidemic response, but public health has unfortunately not been prioritized over the years. If we should have learned a long time ago from Ebola. You would think we'd learn from swine flu or SARS. You think we'd learn from all the natural disasters, hurricanes, Maria, Irma, et cetera. But we continue to sort of follow in the same footsteps. And I'm really hoping that this time it's going to be different. And I truly believe for that, you need to bring in technology companies that's part of that solution, where real-time quick collaboration and having real-time data to access and to understand the landscape is really, really important. I know for us, we've been working throughout this pandemic with a lot of different governments. We released products back in May, we released something called work.com. It was really to help organizations reopen safely, everything from an emergency response management to contact tracing to command center. We've added capabilities for vaccine management, and we released Vaccine Cloud, which really provides end-to-end for the capabilities for businesses and governments. But again, doing that in a silo doesn't make sense, right? So I think other technology companies, all the governments and healthcare providers and education facilities all working together to provide that data into a central database just to show that, we are indeed getting people vaccinated makes a lot of sense. It also pinpoints areas. If you have the right data, you can then understand if there is vaccine hesitancy, or if there are areas where they're not getting the right amount of supplies, or if they don't have enough contact tracers, or if they don't have enough people to give the vaccines. The only way you really understand that data quickly is if you have visibility into that data. So I think that this time it's going to be different. I've seen a lot of collaboration, but we still have a long ways to go. I'm hoping with the new Johnson & Johnson vaccine, once it comes out, single dose regimen, that you don't need to put that in the ultra cold storage. We're going to get a lot more people vaccinated. So
yeah, I agree with you. And I think it's the single dose vaccination is just incredibly important for large parts of the world that are perhaps not as privileged as large parts of America are, and to enable, as you say, to get the world to herd immunity. Even though in the scheme of it, they seem like they're a couple of months behind. And as we write the history of COVID-19, I'm prepared to put a little bit of a bet that the Johnson & Johnson vaccine will have played a major role in vaccinating the world.
Yeah, and I really hope that all the different pharma companies can come together to support the few that are doing really well to get more production and supply out, right? I would rather have a less effective single dose vaccination where it keeps me from dying or getting severely sick. I would rather take the Johnson & Johnson vaccine and save the ones that have the 95, 99% effective rates for the people that have more severe conditions and need those, right? I think we can prioritize, but we just need more supply out there. And there's no room for vaccine nationalism. And if someone does not understand what that means, we're going to be struggling in this volatile economy for a very long time. I think there are longer term, much more broader consequences to having nationalism during this time.
I think if people are unaware that we live in a global connected world, they're probably buried under the head in the sand somewhere. They probably just need to pick up, if nothing else, they need to pick up their iPhone, right? And think about how many of the parts that make up that are coming from all over the world. But anyway, not sure we're going to change anybody's opinion who thinks otherwise on this podcast. As we think about post-pandemic, I spend a lot of time thinking about the winners and losers, right, post-pandemic in the U.S. healthcare system. So I think it's an amazing time in U.S. healthcare, because the innovation that's happening, the financing that's gone towards, and the focus on healthcare. I mean, I remember going to JP Morgan a decade ago and comparing it, actually, thankfully, I didn't miss it this past year, I must say, but move to JP Morgan 2020 and compare the difference in what a decade ago it was all businesses trying to find the scarcity of dollars that were investing in healthcare. And when I was there in January 2020, the number of funds and investors that were coming to me and saying, do you know any companies that you think are really good that we can invest in? We've got to put our money to play. And so that sort of transformation of healthcare becoming the focus of investment and innovation, the focus of the tech world, the innovation that comes out of other parts of the global community focused on healthcare. So it's an amazing time in healthcare, and we can spend a little bit of time talking about those innovations. But first, I'd love to touch on the who do you think who's going to be some of the winners and losers as we think about the sort of post-pandemic U.S. healthcare system?
Yeah, I mean, I'm so excited. I can't tell you, to be at this intersection of healthcare and digital right now. What an incredible time to be around to see this, right? I mean, if you look at, I was just looking at Rock Health report just yesterday, and they were talking about how the investments have gone from, I think it was like 8 billion in 2018 to 14 billion in 2020. I mean, we are going through a pandemic, and venture money is pouring into digital health companies. So we've talked about digital transformation for a long time, but I think what the pandemic showed was you can't just talk about it. You're going to lose if you don't participate in it, right? And I think that's what we're seeing. The incredible uptake of telehealth, and other sort of digital tools, remote monitoring, providing care for patients at home. All of these things have taken off. Decentralized trials for pharma. These are all things that we've been talking about for years. So I think, to me, the winners are going to be a lot of these digital companies. It's a David versus Goliath. And we are seeing that some of the retailers are seeing that there's incredible opportunity to provide that personalized care, access to where patients need it, right around the corner from where they live, rather than traveling 30 miles, right? Or you can provide primary care services from your desk if you're able to do it through these remote channels. So from not naming companies, I think I'm seeing rapid uptake and success for telehealth companies. As you know, we're also seeing much more focused, personalized, engaged service for chronic diseases, right? Like diabetes, chronic heart disease. I'm now seeing a lot of GI startups in the gastrointestinal space where people have IBD, like diagnostics, to say, perhaps we can get you better nutrition, right? And normally you would say that's just not going to work. But there's a lot of new innovation in diagnostics. You have diagnostics one to someone's home, where people can work from their home to understand what's happening, and to really bringing that diagnostics to the point of care at the providers, at where they are. So I'm thrilled to see all of that innovation happening in digital health. And then I think on the life sciences side, we're seeing so much from the research arm. Of course, there's all that stuff around the actual pharmaceutical being done, but that recruitment of patients, remote patients, broadening their patient base as they're doing these clinical trials through remote engagement, retention of all the patients, companies like Benchling and others that are doing these amazing things in this space. We're going to see a lot more of that. But I'll tell you one area that we haven't really focused on or talked about, because we've talked about it for 10 to 15 years, is around interoperability. I think this is the time for interoperability. And I think in the next 1 to 5 years, if you don't focus on, clearly the rules have come out, they're going to make you exchange data. But I think if you don't participate, if you're not part of that ecosystem with open data platforms and sharing, if you don't preserve people's privacy as you're doing this, and you are abusing people's data, but I think all of those things you will be left behind. So that's where I see a lot of stuff moving forward.
So, fascinating that you go to this place around interoperability. One of the frustrations that I've always had is, the government spent so much money on EMR deployment, and there was no requirement or little requirement to drive interoperability at that time. And for billions and billions of dollars, I think looking back, hindsight, obviously always 2020, we probably could have done better. But particularly given your experience, right, as rolling out the EMR across the VA, would love to get your perspective. How do we get the Epics of the world to play that? Is that where government needs to step in and just enforce it, because they're just not going to do it as a private company?
It is the responsibility of people. People are demanding that they have easy access to their data, just like they have it for everything else. They want easy access and sharing their information. They want to have, people want choice of providers, and they want to be able to go and share and have seamless exchange. And I think that's going to drive consumer behavior, and market is going to drive a lot of change and shift. If you look at some of the other industries, look at what Plaid has done for the fintech industry, right? Providing an API where businesses and ecosystems have formed so that I can use my Venmo or I can use whatever other app to connect to my bank and share and have transactions with the click of a button. I want that for healthcare. And I know you probably want that for healthcare. And it's my money. I'm exchanging money. So it's just as important, right? Health is probably more important. I don't know, but people think money and healthcare are two things that, they're regulated and it has to be really secure. So as a consumer, I'm going to expect that sort of ease. And I'm not going to wait around for regulation. I'm going to demand it. I think we're going to see more and more of that. So I think market is going to demand it. So we're going to see a lot more with an API ecosystem in healthcare that's going to start forming. And if I go to see a provider that's in a hospital, and then I go see somebody for my telehealth visit, and I go, let's say, to Livongo or one of these other services, to get my virtual care, I expect that all of those are easily shared and interoperable so that they can provide the best care for me. So I think we're going to start seeing a lot of that API ecosystem forming.
Right. I often think about the fact that, in the days when we used to travel, if I'm, in Barcelona trying to use my credit card, and for whatever reason, it takes more than like 3 seconds for a response, and I'm like incredulous, right? Why is it taking so long for you to charge my credit card? And yet we can't cross the street, right? I'm here in New York. I can't cross the street from, one health system to the next and them to have any knowledge of who I saw and what I did there. And, at least not for the most part, real time today. So it's fascinating what we say about the role of the consumer, because, I think that's one of ultimately the demands that will put pressure on the system. But I think, as I think about the role of the consumer, right, it needs to be in a way where the consumer ultimately is paying more, has more responsibility for their care in order for them to care more, right? It's the old classic diner's dilemma, right? If we go out for dinner, right, and before dinner you and I say we're going to split it, and I see you order a salad, right, I'm going to be a little bit sensitive about ordering like a $60 steak from wherever, right, because that's not really socially very acceptable. But if we were to go with a party of 100 people and no one really knows what anybody else orders, I'll be like, this is my opportunity, right, to get that $60 steak that I wouldn't normally get if I was paying for myself, because I'm just paying. And so that's part of the problem with the consumer in healthcare, right, is that the amount they pay has never been truly tied. And so in order for I'm interested in your thoughts here in terms of for the consumer to play this role. Do you see the consumer ultimately having to pay for more of their healthcare, and that will push them to care more and to demand more as a result?
Well, I think we're already paying more. We just don't know it. Any of us who have employer-sponsored insurance, I've been participating in these employer-sponsored plans for, over a decade or whatever now. And I've slowly seen that my burden has increased and I'm paying attention, but I don't know why it's increased. I mean, if I had a choice and if I had all of the data visible to me where I had a choice to say, okay, it's like, the Yelp for healthcare with price transparency, right? If I knew that going to hospital X for my surgery was a lower cost, 5-star rating, and my employer would give me, I don't know, $500 in my FSA or whatever, HSA, I probably would choose that because I would know that that's overall beneficial. Or if my my amount that I would pay into the employer-sponsored system would reduce, I would select that. But unfortunately, as consumers, we are paying into the healthcare system. We just don't have visibility and we don't have choice right now. So I think, again, our shares, unfortunately, healthcare, one, is getting more and more expensive. So we are spending more. We will be continuing to spend more. But I think employers are also realizing that they're spending more. And so a lot of these types of tools and data sets are going to start coming together where you're going to have visibility into the amount of spend that the employer is spending on your behalf and the amount that you're putting in so that you can make better choices. To your point, human psychology works really well. If I see that somebody else is eating healthy and working out, and that's where I spend my time, I'm going to do better towards that, right? So there are going to be times where I prefer to go somewhere and I want to spend more, but for the most part, you're going to be conscious about the amount you're spending on your healthcare. So yes, I think the burden will increase. It has already increased, but when we are active participants in the system, we will all have a better healthcare system. It's like, it's easy to say somebody else should pay for healthcare, but we're at $4 trillion spend. So the money has to come from somewhere. It doesn't grow on trees. So I think we all have to do our part to figure out where can we reduce the costs? Where can we reduce some of that burden? Some of it obviously is the administrative burden, but some of it's also just like our free spending on this stuff. Absolutely.
Yeah. And for someone who comes from England, which was, obviously a dramatically different healthcare system. It was, I've been in the country for 21 years now, but it was amazing to me when I first came, how easy it is here to both access healthcare and then also how much of it exists and what I mean by how much of it is like, if you couldn't get, thankfully I didn't need it, but if I had needed an MRI, I think they're more in like states, like I think states like Kansas and Missouri have more MRIs than all of England, right? Which is population wise, quite dramatic in terms of the difference in size of population. So it's definitely a challenge, and I think what lots of people don't understand in the country is that the cost of healthcare and the continuous increase is actually going to be a noose around every industry, not just around the healthcare industry. And for order for us to remain competitive in the world, in every industry, we're going to have to do more to fix sort of the cost and quality of care. And so us at Lumeris, we've dedicated our time to sort of figuring out value-based care, right? And how do we move people to be successful in value-based care? And it's sort of the other side of that consumer piece to it, right? How do you align the right incentives between the payer, the physician, in order so they play their role responsibly in delivering cost and high quality care? We're seeing post-pandemic, we're seeing a number of health systems say, I need to move faster to value-based care, because in a world where I get paid based on some type of capitation, right? I'm going to continue to get paid even if a pandemic hits, right? But in a world where I just am reliant on seeing people, and take that with the onset of some of the digitization we've spoken about, the move to home health, right? The need to take a greater role in managing that overall patient seems greater. Do you think the move to value-based care will slow, speed up? How do you see it from your vantage point?
I mean, I would say I would like to see it go as fast as possible, because I think it's good for the system, it's good for the person, it's good for the clinicians, right? But I don't know if I would say it's moving as fast as it should. I still see a lot of fee-for-service transactions, and all of my conversations from my own care or when I see billings are all around fee-for-service. So I'm not sure we really incentivize the system to move towards value-based care as much as like we talk about it. I also, when I see, I think it's great that the retailers are getting into it, because it's important to have easy access and, access especially where people don't have access, like in remote areas. If they're able to provide those services, I think it's great. But I don't see conversations there around value-based care. I've seen some of the retailers take more of a price transparency approach, and I think that's great. But we're talking about it, in my opinion. I have not seen full-blown taking on risk for these types of things. The day that I see all of these digital health companies take on risk, providers taking on risk, that's when I think we're going to see much more uptick in this. But I'm still holding my breath.
Yeah, I see the direct contracting program that came out from the government as a major game changer, actually, in that evolution. And as you push, to move those number of lives in fee-for-service into value-based payments, will dramatically shift, in my opinion, the pace at which we move to value-based care. So we'll come back together in a few years' time and do this again, and we'll see if that turns out to be true. But if the government continues to roll out the direct contracting program, I think that's going to be a major game changer. And look back and say, just the same way we look back and say Medicare Advantage was a major game changer in the way seniors received their care and continue to receive their care. I think we'll look back and say direct contracting was a major game changer.
I agree with you. I'd like to see it heading in that direction, but I agree also, I think we'll be coming back a few years from now talking about this, right? Not as quickly as we'd hoped. So
Ash, we love to end with what we call the quick fire round. So what's the best piece of advice you were ever given?
Yes, I was actually just talking about this with somebody. Someone told me a long time ago, early in my career, to have a kitchen cabinet. So, they said boards have cabinets, others have cabinets. You should have your own personal kitchen cabinet. So I've used that, and I have my own personal board or my kitchen cabinet, and it's been the most incredible group of people. They come from all different places, and it's really helped me on my journey, and I serve on other people's kitchen cabinets. And so I think that was great advice that I was given.
Yeah. So I was, as part of my preparation for this, I watched your, I think it was Startup Health a couple of years ago. And you mentioned kitchen cabinet, and I was really surprised that I won't mention the name of the journalist that was interviewing me, but she didn't know what a kitchen cabinet is. And so I was, I think it's such sound advice, and it's I assume you know the origins of it, right? The origins of it was Golda Meir, right? The prime minister, the first female prime minister of Israel, who literally had in a cabinet to her kitchen, and she cooked them dinner, and
Yep.
and they discussed the sort of most pressing topics, and it's
Margaret Thatcher did that too, I think.
yeah,
So, yeah.
great. But obviously very, very sound advice. And I'm assuming your kitchen cabinet, I know we've lost the quick fire, but this is a fascinating point. I'm assuming your kitchen cabinet comes from, different people from different stages of life, industry, who can, provide sort of a rounded perspective.
Absolutely. I mean, especially now that I've spent time in different parts in technology, I now interface with people across different industries. I've spent time in government, both, spent time in the clinical side. I have now multiple little cabinets. Sometimes my worlds come together, which is always really interesting to see. I wish, at some point post-pandemic, I can bring all of those wonderful people together, but yes, all different perspectives, which has been great.
Amazing. What do you do to have fun, relax?
Oh gosh, I don't know if there's any time for that right now, but I've been meditating, which is new for me. I do about 10 to 15 minutes to calm my mind and take some deep breaths. Definitely having kids at home and homeschooling and working requires a lot of that. So that's where I'm spending my time.
Right, that's great. And finally, if you could change one thing in healthcare, what would it be?
I have so many things on that list. I would take the approach that, I hear a lot of companies talking about customer obsession. I would say bring that to healthcare, to patients. I would say members, but I'd say more importantly, patients. Patients, when you think of them, are sick. So I would say be very, very obsessed with the person that you are taking care of. Patient obsession from every level, right? Whether you were thinking about the clinical care, billing, you're engaging with them for some other reason, having that patient-centric point of view and being obsessed with having delight of those people, of the people that you're caring for, I think is the most important thing. So I would say anything that you're building as a technologist, in these health systems, any interactions have to be super obsessed with your patient's delight. That's what I would change.
Great. Thank you. Thank you for joining us today. Thank you for what you're personally doing to transform the healthcare industry, what Salesforce is doing. I think, as we discussed, there's so much opportunity right now, and so much room for people with your experience and your mindset to really make a difference. So thank you for everything you have done and continue to do, and thank you for joining us today.
Thanks for having me, Nigel.
Thank you for joining us today. Please follow us on your favorite streamer, and don't forget to rate us, as it helps others find our podcast. I hope you continue to stay safe and healthy, and please join us next time as we tune healthcare. This is Nigel Orenstein in New York.